Dylan James, Vice President for Listings here in the Western region with Nasdaq. We're continuing our great content all around the theme of Nasdaq San Diego Week. We've got a bit of a curveball for you here. We've got a great private company here in the area, and I'm excited to talk with Eric Ostertag, who is the CEO of Poseida Therapeutics. Eric, welcome. Great to see you.
Hi, thank you.
So let's just get into it. Let's start unpacking it. Tell us a little bit about Poseida and then the high unmet medical needs that the company addresses.
Yeah, so Poseida actually is a spin-out of another company that I founded about 15 years ago called Poseida. And because it is a spin-out as opposed to a true startup, we have very mature platform technologies. And these technologies can be used for a lot of different things, both CAR-T, which is our main focus right now, and also to potentially treat many diseases outside of CAR-T.
So you mentioned CAR-T. Can you give, just for the viewers, maybe just a standard, brief layman's definition of CAR-T?
CAR-T is short for chimeric antigen receptor T-cell therapy.
Oh, I'll remember that.
It's a version of a cellular therapy, as the name suggests, using a T-cell. And essentially what you can do is take the T-cells from a patient, educate them through a genetic modification step, and then put them back into the patient, and you're educating them to specifically attack cancer.
That's great. Thank you very much for that. You have two approaches to CAR-T and with the next generation cell therapies, and what makes these different and special?
I think the two approaches you're talking to are referred to as autologous and allogeneic.
Yep.
An autologous therapy is where I would take the cells from a patient, do the genetic engineering, and then put them back into that same patient. Now, our autologous therapies are very unique and special compared to everyone else because we use a particular type of cell called stem cell memory. Stem cell memories are cells that eventually differentiate into all the different types of T cells. They can self-renew, they can engraft, and potentially last a lifetime. Every other CAR-T company is using a more differentiated form of this cell. And the way to think about it is the difference between a drug and a prodrug. So in other words, everyone else is giving the patient a drug version of CAR-T. We give a prodrug version of the CAR-T. And now what we've seen in the clinic is that by giving the prodrug version of the CAR-T, we actually completely eliminate or almost completely eliminate the toxicities associated with the early generation CAR-T, which include something called cytokine release syndrome and another neurotoxicity, which is in some patients fatal. This is a big deal for CAR-T because we can actually now give these products on a fully outpatient basis. Given the manufacturing costs of these products, they tend to be relatively expensive, and if you can give them safely and give them on a fully outpatient basis, you can imagine that makes a big difference. 70% of the cost of CAR-T right now is actually dealing with the toxicities. On the other side of the fence, the allogeneic CAR-T would be to take cells from a donor, healthy donor, use them in a similar manufacturing process, but with a single manufacturing run, make enough cells to dose potentially hundreds or even thousands of patients. So it's truly an off-the-shelf product.
Okay.
As you can imagine, that would significantly drop the cost of the product.
Right.
Our goal is to make a fully allogeneic form of CAR-T, so it would maintain all of these wonderful advantages I just talked about with the stem cell memory cells.
So it sounds like it's definitely a space where you're pushing boundaries all the time, right? What kind of advice and counsel do you have for companies that are choosing the same path?
Absolutely pushing boundaries. And in fact, talking about that first product of ours, which is called PBCMA 101, we did almost everything totally different than every other CAR-T company. And what that resulted in, as I just described, is a very differentiated product with completely different safety profile. So I think for certain problems, you can't get good solutions with incremental advances. You really need to do what I would call a quantum leap solution. And cancer is one of those problems that you need a quantum leap solution. I would argue that a stem cell memory CAR-T product is a quantum leap solution.
And CAR-Ts have really revolutionized revolutionized the way we treat blood cancer today, right?
Oh, absolutely. And you don't need to look further than the very first CAR T patient ever dosed. Her name was Emma Whitehead. She is probably cured. She's now 6 years cancer-free. She had a disease called pediatric ALL. Now, we didn't do this. This was done at University of Pennsylvania. But we have a similar story. A patient called Byron Jenkins failed every standard multiple myeloma therapy, and in fact had failed an anti-BCMA therapy from one of our competitors. At the time that he was enrolled in our clinical trial, he was not doing well. Probably only had weeks to months to live. Couldn't get out of bed, couldn't do a simple task like taking out the garbage. And within 2 weeks of being given our product, his tumor was down 50%. He walked out of the hospital. Now he's more than a year out, and he is living a pretty much normal life. He's gone skiing, hiking, surfing even with his family. So this story is on our website, which is www.poseida.com, and that's the kind of difference this is making in patients' lives.
That's the real deal. What does the future of gene therapy hold?
I think if you specifically look at CAR T, you'll see, first of all, improvements in the efficacy of the products, both for liquid tumors, the cancer type of cancers we were just talking about. You'll see efficacy in solid tumors. Then after that, I think what you see are the fully allogeneic products, which will greatly increase the safety and the patient access to these types of products. After that, really, I think what you see is CAR T being used outside of oncology. Because when you think about it, CAR T is really just using a T cell, which is a bag of killing enzymes, to remove an unwanted cell from the body. And in this case, the unwanted cell, of course, is the cancer cell.
Right.
However, you can imagine there are other types of unwanted cells you could use CAR T to get rid of. So you could eliminate the cells that create allergy. You could eliminate the cells that create autoimmune. You could eliminate infectious disease or cells that are infected. You could maybe even use CAR T for eliminating degraded cells, so neurodegenerative diseases. So I think you'll see CAR T expanded far outside of oncology. And then to take it a step further, all of this really, CAR T is just what's called an ex vivo gene therapy. You take a cell out of the body, you use your editing technology or your gene delivery technology on that cell, and you put it back in the patient. Our technologies actually work equally well in the opposite, which is an in vivo gene therapy. We bring the technology to the cell in your body. And so therefore, you can start to think about treating all kinds of other indications, including those that you're born with, congenital disease.
What does the next 3 to 5 years hold for Poseida?
So Poseida, I think right now has established itself as a leading gene engineering, gene therapy company. And in the next 3 to 5 years, given all of our platforms and how broad they are, I think we will become the leading gene therapy company.
That's awesome. So I'm going to write that down. IPO. I'm just kidding. I'm going to put the cart before the horse. Eric, this has been great. So to wrap up, what we have right behind you is a version of our Nasdaq Tower. And this will be a quick lightning round game, all on advice and counsel and good lessons learned that you've picked up over the years. You want to play?
Sure.
All right, great. Thanks very much. Okay, we're back. We're going to play the game. Eric, are you ready for this?
I'm ready.
Okay, let me take you through it real quick. We've got the Nasdaq Tower here on the screen. 3 categories: inside look, advice, and success. You can feel free to pick from any of the cards on the board. So you can go, hey, advice 400, and we're going to ask questions and run through it as fast as we can in 1 minute. Sound good?
I'm ready.
All right, great. Do we have a timer? All right, 5, 4, 3, 2, 1, go.
Success for 800.
All right, big money. Love it. What are your metrics for success?
How many people can we help?
That's right. Okay, next.
Advice for 800.
What is your best productivity hack?
Put the cream in your coffee before you pour the coffee in it.
I love it. It's the best answer we've had all day. Next question.
Inside look for 800.
Okay. What is your favorite way to get organized?
I like to take a little time out to just think about things.
Perfect. Next question.
Inside look for 600.
When you're not in the office, where can we find you?
Lake Tahoe.
Awesome. I love Lake Tahoe. Next question.
Advice for 600.
Who do you look up to?
Really anyone that sacrifices their own personal agenda for the good of society.
That's awesome. We got 10 seconds left. Let's get two
Success
more.
for 600.
Success 600. What are the crucial elements to any successful team?
I think being open and collaborative.
Okay, great. One more.
Advice for 400.
Advice for 400. What is the best piece of advice you've ever received?
Get the right people on the bus before you start driving.
I love that. I love that. Get the right people on the bus. Eric with Poseida Therapeutics. I'm Dylan James with Nasdaq. Thank you so much for joining us. That was a lot of fun. Appreciate it. Thanks everybody for watching. Again, this is all part of Nasdaq's San Diego week. Please keep watching for more incredible content, and we'll see you next time.